Hello friends, welcome back to another video tutorial from Shomu's Biology. And in this video lecture, we are not going to talk about any of the typical stuff that we do. Here today I'm going to talk about work from home and the side effects of work from home. Now, if you are working from home for last 6 and 7 months, answer very basic question. Okay, I'm going to ask you some very basic question. The first thing is that, do you feel pain in your head? Okay, from particularly the front of the head and slowly radiating to the backward side. Do you feel that? The second question is that, do you feel pain in the lower back part of your lower back here in this side? Okay, in the vertebra of the lower back, do you feel pain there? This is the second thing. And the third thing is that, do you feel like stressed out and a lot of shoulder pain, shoulder jam, when you after the end of the day you feel like very stressed out, okay, due to this, and anxiety builds up a lot. Okay, these are the three things that hampers most of people who are working from home. If you are a working professional, the probability is that for past 6 and 7 months you have been working from home. Okay, for IT sector professional or freelancers, they're like mostly freelancers have their whole life working from home. I have been working from home since 2012, so I know about the pros and cons of work from home. This small term, this work from home, brings you so many problems. That's why, even though you think like it's very good to work from home, there are positive sides, it's your own time, you can manage it and all, but still it is with a cost, and that's what we are going to discuss today. The most important problems associated with work from home and how to get rid of them. So what are this kind of pain? Mostly if you talk about the spinal pain that you have, most of the people actually, if you think like the working from home related pain, the maximum pain, like approximately 60% and above of that pain is the spinal pain, the low back pain, 60% above. Then comes the shoulder pain. Okay, so obviously after spine there is a shoulder pain. Then the third one is the pain in the skull, in the front of your head, and the fourth one is the pain with the other issues. Okay, the issue with your vision and all. These are the four things according to the study. So the most of them are the spinal pain. Okay, so what is the reason of the spinal pain? You feel very pain in this low back side of your vertebra. The reason behind it is that you are working from home. So you're working from like you're sitting into a chair and just doing your job. Some people even don't sit in chair and table to do the job. I know many people are doing their job from their bed, and this is very, very bad. If you're doing work from your bed, just stop that immediately and get at least a table and a chair if you're working from home for long hours. Okay, so because if you are working, normally our always it's told like you need to sit like this with your vertebra straight, but nobody does that, right? Nobody do. So I never also do that because it's not possible. Even though you think like this, I need to be straight when I sit, but automatically after some times when you dig into the work, you automatically gets like this. Okay, so your vertebra bends like this. So here I'm not going to talk about any anatomy lesson or anything, but I want to give you a simple idea about our basic vertebral structure in the back to understand the back pain more easily. You have this 4 different sections of our vertebra. We have C, spine, we have C, then we have T, then you have L, then you have S. Okay, C, T, L, S. This is how you should remember, C, T, L, S. And how many of the C are there? 7 C is there. Okay, cervical spine, we call them cervical spine, C1 to C7. How to remember it easily? CR7, Cristiano Ronaldo, jersey number 7. So you should remember that C is 7, C1 to 7, 1 2 3 4 5 6 7. Here it ends, the C1 to 7. Then comes T, T is 12, T1 to T, known as thoracic spine, T1 to T12, CT. Then L, lumbar spine, L is 5, L1 to L5, and then finally L ends here. Okay, CTL, lumbar spine, and then sacral spine, S, 1 to 5. And sacral spine is here. I don't know whether you can see it properly here. And at the end we have coccyx. This one is the coccyx. Okay, so this is overall structure. Now the pain that you will feel most of the place, that will be in the L spine, L5, L1 to L5. This is the place. So this is C, cervical spine. most of this neck injuries and neck pain are related with this cervical spine. Okay, cervical spine is the region where the spinal cord is connected to the rest of the central nervous system, which is the brain. This is the skull, this is the back of the skull, the rest of the skull will sit on top of it. So this is the back part of the central nervous system. Central nervous system consists of the brain as well as the spinal cord in here, and you can clearly see in this picture, in this diagram, in this model, 3D model. If I show you like this, it will be better, I think. Yes, it will be better for you to visualize. You can clearly see that this yellow colored stuffs are coming out from there, right? Yellow things coming out of this. And if I show you, this is the spinal cord, the yellow colored thing, this is the spinal cord in here. Okay, and from this spinal cord, nerves are coming out from each of these vertebra. There are discs. Okay, there is a gap between each of these vertebrae. You can clearly see this. These are known as intervertebral gaps. Okay, intervertebral discs. Now normally these discs are there, okay, because why discs are there? Because these are like small joints, okay, small joints, and between the joints there are these disc structures. So these joints can move, okay, without any friction. Okay, so these discs are there, known as intervertebral disc. Now the problem with this disc can arise something like that. One kind of problem is when this disc is trying to bulge out. Okay, we call it, disc bulging. Or the disc can be when it bulges out from it, means it is moving from its normal shape and structure. We also call it herniated disc. Herniated, the word hernia means something is coming out or bulging out. So herniated disc, it's known as herniated disc. So if herniated disc is there in any part of this vertebra, that's going to be a big problem for you. Either you can witness the pain in the T, very rarely though, T 9, 10, 11, 12, or most of the time the pain, the lower back pain that originates is from the L, the lumbar spine. And the lumbar spine is the place where your posture is not correct. If your posture is incorrect while you're sitting, then there will be a pain in the lumbar spine. The reason of pain, what is the reason of pain? Because we have nervous system, right? And a nervous system is very, very important to signal our body if there is any signal coming out from our outside. Any kind of signal, pain, heat, pressure, or any kind of signal, this nerve will pick that signal and send it to our brain, and our brain signal it to our muscles to work accordingly. Now for example, if I take my finger here and I am going to take my skin and rotate it like that, you'll feel pain, right? Now the moment I release it, the pain is vanished, it's gone. Now normally this is the spinal cord, this is moving through this vertebral column. Okay, if you look at the vertebral column without the spinal cord, what you will see is that a pipe like structure. If you see, it's a hollow pipe. Now through this hollow pipe, this nerve system, the whole central nervous system, the back side of the central nervous system, apart from the brain, that is the spinal cord, is moving through it, and the nerves are coming out from every single point, every single node, every single joint. In intervertebral disc, there are nerves coming out. Okay, so these nerves are coming out, and the moment the nerves are pinched, even a little bit, if you pinch this nerve even a little bit, that's going to create immense pressure on the nerve, and the nerve will sense the pressure, send the signal to the brain, and you'll feel huge pain in that area. And what happens here in this low, so if you are sitting in that same posture, for example, you're sitting something like that in the low back posture like this. Okay, if I show you like here, like this, the back is like this. So what happens here in this side of the this place, the L spine particularly, it bends like this. It should not supposed to be present like that. Okay, so due to this bend continuously, it creates pressure. Okay, it decreases the gap between the L vertebra, between two L vertebrae. It can be between L2, L3, L3, L4, L3, L4, L5, between any of these lumbar vertebrae. As a result of which, the nerve which are coming out from this vertebra, from the spinal cord, there is going to witness a pain, pressure, and then it causes the pain. So this is the place for radiation of the pain in the lower back side. Now the second thing, the pain that you can observe in your neck. Okay, so if you are looking at your screen, at the monitor screen for long duration of time, if the monitor screen is not in proper alignment of your vision, then you will also feel pain. For example, if you are working in a bed, you are sitting in the bed like this, and the monitor is also in the bed. I mean the desk laptop is also in the bed. So the laptop screen is below your vision, so you need to see something like this. The same thing happens to us when we are looking into the phone. We never use phone like this. Do you use phone like this? Never. What we do, we always use phone like this. So what happens, actually we are looking like this. So look at my posture here while I look at this like this. Okay, so the same thing with laptop. If I do something like typing something here, so my vision is like this. So my shoulder, you can see it's slightly tilted. Okay, so it's supposed to be like this, but now it's like this. Okay, so as a result of which our vision is narrowed due to the screen. The screen is here, the vision is narrowed, and the shoulder is also fixed in an angle, okay, for long duration of time. And if you do not rotate your shoulder while you're working, if you do not do the neck exercise regularly, then that will create again a strain in the C1 to C7, and that will create pain in that area as well. So this is what happens. This is what happens all the time. All of us, people don't take this thing seriously. When you're working from home, obviously take this seriously. Now this is related to problem. I've discussed about these problems associated with it, particularly associated with the spine. Okay, so now what to do to fix this kind of problem? Now I'm talking from my personal experience. The very first thing that you should do if you are working from home, or if you are planning to work from home for a long duration of time in your life, for a long time of your life, then you must take a good chair. Okay, a chair that will help you in a perfect posture, or a support at least. A good ergonomic chair is very, very important. Now a good ergonomic chair may cost you something from 5,000 to 9,000, 10,000, 12,000 rupees and all. Now people may think like it's a huge investment for a chair. Just for a chair I'll invest that much. If you don't invest in the chair for 5,000 to 6,000 rupees, if you're working from home for years to come, then you need to take medicine of that amount every single month after your age crosses 35 for a woman and 40 for a man. Mark my word, and this is going to be, you're going to pay doctors, you're going to pay the medicine suppliers that money, and even you may need to do surgery if there is stenosis in your vertebral column. Now what is stenosis? Stenosis, as I said, that this vertebral column, it's a hollow chamber through which the central nervous system, the back of the central nervous system, rest of the part of the central nervous system is moving down, moving through this place. Now that is like a pipe, like a hollow pipe. Now what happens if that let's say this is let's say the diameter of the pipe, and it decreases. So what will happen? There is the all the nerves. Okay, there is our spinal cord. Now if the area it decreases, it creates pressure in the spinal cord, and when the area decreases, the diameter gets decreased due to any sort of deposits into that vertebral column. Due to that, immense pressure is applied into the vertebral column, immense pressure is applied to the spinal cord, and as a result of which you will feel numb. Okay, so the nerves coming out from that area will no longer do proper signaling. So what you will feel like, if it's stenosis of the place where for example the L spine. Okay, so what will happen if it's done in the L spine? Then the L spine normally signals bottom. Okay, so from the buttock to the rest of the body, like the legs, left, right leg to the toe and everything. Every part of the body, the bottom part of the body. So what will happen here in this point, it will stop do its normal job. So what will happen, you will feel numb. After a few minutes, if you're not moving your leg, you'll feel like there is like almost paralysis, kind of temporary paralysis effect you will feel, and that is dangerous. If this thing continues and stenosis increases, then you may need to end up in operating this whole thing, and this operation is not that easy. So make sure, the very first thing, you buy a good chair. If you intend to involve yourself in a position of work from home culture, then you need to buy a good chair that will give you a comfortable position. You can sit there comfortably. They have a back lying posture like this, and all these things must be there. You can put your head and rest there for some time in between the work. This is the very first thing. The second thing that is, never ever work in sitting in the bed. Okay, always take table and chair, and obviously remember the table must not be a dining table, because dining table is designed for our eating habits. So the table should be office table, so that the difference between the table height and chair is maintained in such a way so that it's comfortable for your health. And practically speaking, I'm not talking like some information from the internet. Practically speaking, sometimes happen like you are involved in a work in such a way so that 2 hours, 3 hours passes by and you start feeling pain. So the moment you start feeling pain, what you should do is that you stop it there and go there. And many people are involved with this idea known as obsessive compulsive disorder. So those people try to feel like closure. You know, when I start a work, it's also grasping me, because when I start a work, it's always an idea that I finish that portion of the work, then I'll wake up, then I'll move and walk and do the exercise and all. So this thing is always there, and if you are a victim of this habit, then there is also always a problem, like, you know, there's no one to poke you in the middle. You are closing the door of your office and you're working hard like that. So the better thing is that you keep an alarm, okay, after every 1 and 1.5 hour, and that alarm continues to goes off, and that will piss you out, okay, that will piss you off for first few days, but sooner or later you'll realize that yes, the alarm goes off after every 1.5 hours, so I need to get up for at least 5 minutes. I just go and take a walk somewhere for 5 minutes. I just walk in the home for 5 minutes, drink water, and then come back and sit and again start do the job. And remember, this 5 minutes break in the middle of 1 hour, 1.5 hour of work will give you good benefit at this point of time, at the very beginning. And apart from that, if you're working from home 6 hours, 7 hours, 9 hours, 10 hours, for like us, we are involved with coaching and study, we are running YouTube channel, we are doing this and that, and many more things we are involved with. So for my case, my whole day is packed. The moment I wake up, my work begins, and the moment I sleep, my work stops. This is what happens in our life. It's so packed in work. So what I do always, you need to take some time off for exercise, okay? So by any way the exercise can be, okay, it can be any kind of game, it can be any kind of gym. It's not like mandatory gym you need to do. I don't do gym like that. What I do is that I take care of the diet that I'm eating, and the second thing, I also involved in the process of, I personally feel myself better at invested my time in some sort of sports rather than doing gym. So either you do the sports, you do like you have you can play football, you can play cricket, you can play any of the sport that you are, outdoor sports of course. And if you have place, because in my house I have the ground I have a place where I can do that. So for in winter times, it's always a good time to burn some calories by playing something. It can be football. You don't need any other people to do that. You have a football, you have a ball, you can practice dribble and all things. That will work as a good exercise. The other thing is tennis, okay? So there are tennis trainers you'll easily find out for 2,500, 3,000 rupees, and you have a tennis bat and you just practice on your own. You can practice those tennis training equipment with a single player game. So you can just practice those things. I find myself interested about those topics. So 30 minutes of this game at the end of my day, let's say after 9 p.m, 9:30 p.m, I go there and 30 minutes burning out some calorie, as well as I feel myself rejuvenated. And when you start this process for the first time, first few days you'll feel very tired, very exhausted, but as you continue to do that, for 1 week or so, you'll feel yourself accommodated, you'll feel yourself accustomed with it, and you will no longer feel it tiresome, okay? And one more thing is that you'll start to see the change, and one more thing is that also add a purpose to your life. You're working, and that will add a purpose. And what kind of purpose? It will be something like, at the end of this work, I'll go there and I'll play some game. So that changes your mindset. And rather than binge watching something, just do that for 30 minutes, then do anything else you want to do, because we live in an alternative lifestyle. We know that we sleep at very late night, we wake up at very late. So all these things are there. But apart from everything, to keep your back healthy, to keep your orthopedic structures, your body postures healthy, this 30 minute is very, very important in your life. So if you do these things, then you can you can get some relief from all these pains that you are accumulated here, okay? And also remember, if you're working with a desktop or laptop, and if there is no chance you can use a table or chair, then use at least something like a tool or something on top of which you can put this laptop, so that the screen comes in face-to-face contact with you, so that you can type things, and that can release some tension which is applied here in your neck. So this can be beneficial for you. And another problem that is associated with this work from home stuff is the big tummy. The tummy grows up. If you see yourself for this whole lockdown period of time, almost everybody gained weight, almost everybody. And this whole period of time of gaining weight, I reduced myself 5 kilos of weight. Although I am not overweight, I was normal weight, but still I had 5 kilo weight get down. Now it's time for me to gain some weight, so I'll gain some weight. So gaining weight is fun, but losing weight is not. So during this 5, 6, 7 month of time, I saw most of the people gaining weight. The reason behind is that they are working from home. They are not accustomed for that. Okay, so they're eating wrong, they're sleeping in the wrong time, they're doing most of the things wrong, and as a result of which they end up in this huge tummy popping out. Okay, and the back pain, neck pain, most of the people who earlier used to work without a glass, now they are wearing glasses. You know, glass is something which eventually everybody need to have. If you're working using computer screen, you need to have a coating out there and all these things. It's necessary, because you need a filtering ray, because constantly the light is coming into our eye. If you are watching in a big screen or a mobile phone, in any of these cases, backlit devices are increasing day by day. It's going to hamper your retina, it's going to kill your eye, there is no doubt about it. But again, what you can do, you need to get your a proper wallpaper. You know, wallpaper, if you are using something there, so make it white color, okay, and the brightness normally controlled. So there are themes, okay, dark theme and light theme. Always try to go with the light theme. And also, if you are using a wallpaper and staring at something in the background of your office or places, you should put something of light green color or blue color, like a sky, like green grasses or trees, which helps to some extent. But most of the important things I already shared. One more problem that you may face if you are working from home is related to the gastrointestinal issues. That is related to constipation, related to diarrhea, related to IBS. The symptoms of IBS, it will never end. So I'm not going to talk about the IBS in this video. I'm going to talk about that in the next video, which is effect not only of work from home but of alternative lifestyle. We'll talk about that separately in a different video. But for this video, to reduce all this thing, I mentioned you different habits. You need to modify your habit a little bit. So remember, every single habit is something that takes a long time to build up. So you cannot just turn the habits around overnight. You can only do that after a regular impact, 1 week, 2 week, 3 week, then only you can achieve the task. So at the very beginning, do not get very much frustrated if you cannot change the habit, but try to do that and eventually achieve it. So that's all for today. I know the video is long, but that's all for today. If you like this video, please hit the like button, share this video with your friends, and share with us all your issues regarding the work from home. Share with us, and so that we can make new videos regarding the issue and can help you to solve that problem. Okay, so please share this video with your friends and write in the comment section about your issues that you faced during your work from home phase. Okay, so with this pandemic, and if there is no vaccination comes closely, then work from home will continue for some period of time. And many companies decided to continue with the work from home policies because it saved them some money, as well as the work productivity is also good, it's not compromised. So it will be the future. So if it's the future, then rather than paying a hefty amount of money to the to the pharmaceutical companies and doctors, you should save yourself from it. Okay, and not only you, but the doctors are also facing the same issues, because they are doing the same job, again sitting all the time. So this is very, very important for all of us. Okay, thank you, bye.